Which of the following is the most appropriate for initial management? So a 40-year-old woman consults her primary care physician with concerns about bilateral breast pain and lumps that she has noticed over the past month. She reports that the pain worsens before a menstrual period. On physical examination, the physician notes multiple tender mobile nodules in both breasts. The physician recommends a conservative approach to manage the patient's symptoms. Which of the following is the most likely initial management? Pain worsens during menstrual period.
So give me a diagnosis.
Mobile. I kind of want to think like fibroadenomas because they're
Okay.
mobile.
Okay.
I think they're called fibroadenomas, if I'm not
Okay.
mistaken,
So
because
what do you
they're
want to do?
mobile. Because they get worse before her menstrual period, I think I want to go with hormonal therapy.
Okay. Oops. Okay. Final answer.
I think so.
Okay. So let's see here. So this is actually fibrocystic changes. Okay.
Mm-hmm.
So let's talk about that. That's a good. I like you said, you're getting better. You're getting very, very close to the diagnosis, and I like that. So let's talk about what's the difference between fibrocystic changes and fibroadenoma. What's the difference?
I want to say perhaps like fibrocystic would be um like would it be like more nodules
Yeah.
than
So the
fibroadenoma?
way I remember it, okay, so fibroadenoma is usually, right, one. So if this is breast, right, if you have a fibroadenoma, it's usually one nodule. Okay.
Mm-hmm.
And they also remember fibroadenoma also changes with hormonal cycles. Okay. So they change with hormones. Fibrocystic changes are multiple and usually, for the most part, they're bilateral.
Right, I see.
One is only singular, the other one is multiple. That's why it's called
Multiple
fibrocystic changes with an S. Does it make sense?
fibrocystic changes is multiple. Okay.
Okay, so let's read this here. I didn't actually, once again, this is not really fair game for step one. It's more of
Mm-hmm.
a step two question because anything with initial management, you can just think to yourself that that's more of a step two. So you really want to focus on getting the diagnosis. So let's see here. Patients bilateral breast pain before menstruals, along with multiple physical exams, consisting of fibrocystic breast changes. Initial management for biological changes include conservative measures such as dietary modifications, so reduce caffeine and salt intake, and wearing a supportive bra. Okay. But yeah, so that's kind of something that I mean, I didn't know that. That's something new. I didn't know that caffeine and salt intake makes that worse. So that's always something you can think about.